Good day, sir.
Good day.
Please, can we get to know you, sir?
I'm Dr. Adejumo, the Medical Director of Mainland Hospital, Yaba, Lagos.
Can you tell us about the current cholera outbreak in Nigeria? How bad is it and how long has it been going on?
Well, I don't have good information for you concerning the country situation, but I can tell you about Lagos. In Lagos State, the outbreak started around 9th or 10th of June this year. That's when we started having increase in people with gastroenteritis. And we happened that it has now spread to all the local government. It started from Lagos Island local government. That is where we have the highest number of cases. So basically now we have cases in all local government, but the local government mostly affected are Lagos Island, Oshofe, and Lagos Mainland Hospital. However, on the 17th of this month, we have the highest number of cases, and since then it has been coming down. Before the Layer Festival, we have a very low number of people. The number of people coming down with gastroenteritis were very few. But post Layer period, there have been a little bit of spikes that we have recorded so far. And that's how it is. But basically now we have virtually all the local government reporting cases of gastroenteritis. But it's not as bad as it was. It's not as bad compared to what we have on the 17th of June.
What are the main reasons this is happening in Nigeria right now? And what are the factors causing it to spread?
Well, for now, the commissioner made a press release yesterday. We don't really know the main cause, but there are postulates here and there, so what could be the possible reason? But it's not been verified. So I won't want to talk about things that are not verified. But other causes will know that that could be related. Normally, we usually have cases of gastroenteritis around this time of the year, rainy season. We know that open defecation is still rampant in the state. And so when people have open defecation, when it comes, washes some of those excreta into water bodies, and some people get to drink out of those contaminating water. And some of our people have the situation, the way they situated their borehole is very close to their septic tank. So sometimes there's a sort of contamination of water bodies during rainy season. So that is most likely because normally on a normal day we usually have cases of gastroenteritis coming around rainy season, usually higher compared to dry season. But while we have this spike, the state is still investigating the true cause of this spike.
Can you describe the symptoms and health problems you've seen in patients with cholera?
Yeah, the symptoms basically include people complaining of abdominal pain, vomiting, diarrhea, and some of them become very weak, become lethargic, and they complain of weakness, body weakness. Those are the major body presentations when patient comes. So patient comes in very, very dehydrated. Some of them feel weak, some of them lethargic, and you have to rehydrate very, very, very fast. In fact, some of them come down with acute kidney injuries, and we've had some fatalities from this outbreak.
What treatments and methods are being used in the clinic to take care of these patients? How well are these working so far?
Well, basically, case of gastroenteritis. Well, I forgot to tell you the other time, we've had laboratory confirmation of cholera, but not all the cases are cholera patients so far. So when they come, basically, they come in dehydrated. So the major thing is to replace fluid and electrolyte. So because they've lost a lot of body water. And so we have to replace the body fluids back. So the major aim of treatment is to replace lost fluid, and that's what we do as fast as possible. So when they come in, we assess them. If it is severe dehydration, we'll start IV fluid. So we rehydrate them. But if someone comes and it's mild dehydration, that's when they are given ORS. So when you replace, as you are replacing, you are taking their blood to check the electrolyte and urea levels. So we have to assess the kidney functions. And we also give them antibiotics. We give them doxycycline and there is erythromycin. That is what we're using majorly now for as antibiotics to kill the cholera, to handle the causative organisms, and make sure that we replace body fluids. So far, we've recorded success. Majority of the patients come, and if they come in early, the chances that they'll get out of it is very high. But this health seeking behavior of our people is terrible. People will use home remedies, use all manner of remedies at home, consult local chemists, and when every other thing have failed, that's when they present to the hospital. So people that have late presentation, unfortunately, some of them die from complications relating to acute kidney injuries. But we've recorded remarkable success in our management.
How are the health authorities and government responding to try to manage the outbreak? What are they doing for prevention, monitoring, and emergency response?
Well, the government has done a lot. They've moved in swiftly since the outbreak was reported, and then our emergency operational center has been activated. And an outbreak like this requires multi-sectorial collaborations and several people, apart from the medical people, the environment people, people in charge of water, people in charge of sewage, every other sector, risk communication, every other sector have been mobilized. People have been sensitized. There have been a lot of sensitization and jingles and going on in the community, telling people about the outbreak, what to do to prevent it. So the states have moved swiftly, provided commodities to hospitals, provided free treatment to victims, and the state has done a lot to make sure that they control the outbreak.
In your medical opinion, what long-term solutions or improvements are needed to address the root causes of cholera outbreaks and better prepare for them?
Well, cholera is a fecal infection. That means something that has to do with feces coming contaminated with food and water and people drinking it. So a lot has to do in terms of proper, we must have potable water. We must have potable water. Then sewage disposal. We must have effective sewage disposal, because if we have effective sewage disposal, there will be nothing like open defecations that we have everywhere. Our water bodies will not be contaminated. And people who have septic tank close to their boreholes will not happen if the government has provided potable water for people. So those things needed to be done. So you find that there must be potable water provided, sewage disposal, better housing, and environmental sanitation. Then when you also have to talk about proper hygiene. Now, people need to learn that habit that when you go to the toilet, the first thing you need to do is to wash your hand with soap and water. When you buy fruit, you don't put it in your mouth, you wash it before you eat. Then you see some of our drinks, you see our drainages need to be packed. So a lot has to do with environmental sanitation. And if we can get that one right, we can reduce or we can prevent this from occurring in the future.
Are there any new treatments, technologies, or research findings that could improve how you're able to respond to this outbreak?
Well, if cholera is endemic, one thing we can do is to also vaccinate. We can vaccinate our people. There are vaccines for cholera. At least WHO has approved 3 vaccines for cholera, the oral cholera vaccines. So this, but the downtime, the downside of it is that it will just last for 3 years. That means when you vaccinate your population, you need to do it every 3 years. That's another new technology that will be added that will be a game changer.